Hello, everybody. My name is Mike Lagerquist. We are here at Vine Faith in Action with a very, well, it could be a timely subject at any time of the year, but it is going through some of the basics about Medicare for folks who are either approaching retirement age and are going to be applying for Medicare, or those who have some questions about the programs that maybe that they are participating in right now. We've got Nelson Schmidt from Blue Cross Blue Shield of Minnesota, who is going to be answering questions. So, and he tells me that at some point he will also give his contact information. So if people have questions, we'll be able to contact him directly, and I'll see about putting that on the posting for this on our website as well. So with that, Nelson, take it away.
All right. Well, great. Well, Mike, thank you very much. Again, my name is Nelson Schmidt, and I've been with Blue Cross Blue Shield for just over 8 years. And in my time at Blue Cross, I've really focused almost exclusively on Medicare and Medicare supplemental health insurance. So it's my role to help people understand, how does Medicare work? When am I eligible to sign up? How do I sign up? When does coverage start? And, what does Medicare cover and what does Medicare not cover? And then I'll also help educate folks and advise on supplemental Medicare insurance. So do you need something more for your health insurance that's once offered through the government, through the Medicare program? And if so, there's a lot of different supplemental plan options. So how do you go about deciding which one of those supplemental plans is going to make most sense for you? So we'll plan on doing a nice overview today of both Medicare and some of the different supplemental plans that are available for you. This is intended to be kind of a nice general type of overview. And as we go through the presentation, if any of you have any questions, Mike, if it's okay with you, you can just, start asking those questions and I'll address those. When we do wrap up the presentation portion, I'm happy to stick around as long as you'd like to address any questions. And I will also here share my screen. Hopefully you can all see that okay. And you do have my contact information up there. That's my direct phone number and my email. So by all means, feel free to reach out to me at any time. I do work with folks on a one-on-one basis and offer consultations, and I'm happy to do that for you. So, Mike, thanks again for the opportunity to be here today, and thanks for everybody attending. And like I say, as I go through the presentation, if any questions come up, just feel free to ask those. So what we'll cover in the presentation, really two different parts. We're going to talk first about original Medicare. And when we say original Medicare, we're referring to Part A, that covers you when you're in the hospital, and Part B is in Bravo. That's going to cover everything you do outside the hospital. Those two pieces together, A and B, are called original Medicare. And that's like the base coverage that everyone in the country starts out with, right? So no matter where you live, that Part A and Part B are your first step in getting coverage. That's the base coverage, and that's what you're getting from the government. All right, original Medicare. And then we'll move on and we'll take a look at some of the different supplemental plan options that are available to you. And we'll talk about some of the differences between those supplement plans. And we'll kind of identify, some key criteria that you're going to want to take into consideration when choosing which one of these supplemental plans is going to work best for your particular needs. So we'll go into first here enrollment periods. Now, the most common way people qualify for Medicare is they simply turn age 65. So if any of you listening here today are going to be 65 soon and new to Medicare in the near future, that first period, the initial enrollment period, is going to be important. This initial enrollment period, and there's a graphic there above, it's going to include the month you turn 65, the 3 months before, and the 3 months after. So it's a 7-month window. Now, if you happen to be collecting your Social Security benefits for at least 4 months before you turn 65, well, then you're automatically going to be enrolled in Part A and Part B original Medicare. That'll happen automatically. You'll get a red, white, and blue Medicare card in the mail, usually 3 to 4 months before you turn 65. Now, if you're not collecting those Social Security benefits, that's okay. You're still eligible for Medicare when you turn 65, but now you are going to need to initiate turning those Part A and Part B benefits on. And you're going to do that by contacting your local Social Security office. You're either going to call them or you're going to go onto their website. And in the next slide or so, I'll have that contact information and you can jot that down. And by the way, if you want a copy of this slide deck, let me know. I'd be happy to email that to you or send it in the mail. All right. So that's the initial enrollment period. Now, important to note here. Oh, yeah.
So you have to reach out to Social Security. You can't just like do it through your insurance people to get on?
Yeah, you're right. This has, so unless if you're collecting your Social Security benefits for those 4 months, it'll happen automatically. But if you're not, you do need to actively reach out to Social Security and let them know you want to start Medicare.
Okay.
And the time frame of when you can do that, it's during this 7-month initial election period. Now, as long as you're contacting Social Security during those first 3 months before your 65th birth month, then the effective date for your original Part A and Part B Medicare is going to be the first of the month in which you turn 65.
Okay, like, so I'm June, so I need to do that this month.
Yeah, you'd want to get started with that. Absolutely. So you're eligible to do that right now. And, as long as you're taking action between today and the end of May, you're going to get June 1st. Now, one exception there, if you're born on the 1st of the month, were you born on June 1st by chance?
No, 2.
Okay. All right. Just missed it then. If you're born on the 1st of the month, you get a month early eligibility. So if you were born June 1st, you could get into Medicare May 1st.
Okay.
But anyone born between the 2nd and the 31st, it's always then the 1st of the month of their birth month.
Okay.
Now, if you waited and you applied, say, during June or whatever your birth month might be, or the 3 months that follow, that's fine. You're eligible to sign up, but now the effective date for your coverage is going to get pushed out a little bit further.
So it is important to do it like right now,
Absolutely. And, I'll tell you, you used to be able to do this in person, but Social Security offices have not opened to the public. And I can tell you they're not fully staffed like they used to be. So it's taking a little bit. Yeah, it's just the process takes a little bit longer than what it did, prior to a year ago. So the earlier the better. And that's important because you need that Part A and Part B Medicare in place, and you either need a letter from Social Security that says, hey, welcome to Medicare. Here's when you're going to start, and here's your Medicare number, or the Medicare ID card. The letter usually shows up first, but you need one of those two to apply for any supplemental coverage, because on any application for supplemental coverage, we're going to need to put in that Medicare number and the Part A and Part B effective dates. All right. So
I had a weird thing happen the other day. I actually got a letter stating something like that, but it was written to my husband, who's already been on Medicare for probably 4 years. And it's like, why does it have his name and not mine? But it's
that's odd.
Gosh, you're turning 65. I'm like, no, he's not. He's already there. So what number, or who do we just call the local office here, period?
You can call the local office, and I'll have a general number for Social Security on the next slide. You can call that one and they'll direct you to the local office as well. But you can, that local office is the best place to go.
Okay, thank you.
Yeah, thank you. Now there's also what are called special enrollment periods. And there's a number of these, probably 20 or so different events that may open up a window of opportunity for you to either sign up for Medicare for the first time, or in some cases, it might give you an option to change whatever kind of extra supplemental coverage you've added on top of those original Medicare benefits. Now, we won't today go into detail on all those special enrollment events, but I will mention and talk in a little more detail about the most common special enrollment event that I see. And that would be people who turn 65. So they are indeed eligible to go on Medicare. However, they're working and their employer offers a health plan that they really like and they want to stay on that. Well, you can do that. You can stay on your employer plan and put off Medicare as long as your employer is offering what's called creditable coverage. Now, creditable just means as good or better than what Medicare offers. And to find out if your employer is offering that kind of coverage, you can talk to someone in HR or whoever handles benefit administration at your company. So if you want to do that, you got creditable coverage, great. Stay working, stay on that employer plan as long as you like. And then when you retire, that is actually the special enrollment event. Now you can go into Social Security, let them know you're coming off an employer plan and you're ready to start Medicare. All right, so just again, a little more about the timing, when you're eligible and when you can sign up. So we'll move into the next slide.
Quick question for
Oh yeah,
you.
please.
We are self-employed. My husband, like I said, he is on Medicare and we haven't started drawing Social Security. We were gonna wait till he was 70,
Mhm.
but we were gonna start mine probably soon. But we've been covering my insurance, of course, out of pocket and through the business, but so how soon do I just make that so that ends when the other kicks in? Do you just stay on that till that point?
You got it. So
We're paying a lot of money.
yeah, so probably a nice light at the end of the tunnel with going on Medicare compared to what the coverage you have now.
Right.
And what you want to do, general rule of thumb is don't cancel anything until you know you're accepted and set up with your effective date on the new plan. So
Okay.
I would take care of that first, get in touch with Social Security, and you've got the phone number here or their website that you can use to apply. And then once they welcome you and once you get your supplemental coverage set up, then you want to cancel that plan you're on right now. And as long as you do that before the end of May again, then you'll cancel that plan, as of the end of May, and in June 1st, the new Medicare coverage will start.
Okay. Thank you.
You got it. And again, this slide just simply has that contact information for you. And let me know if you want a copy of this. I can send that out. So that's kind of how you enroll in Medicare, the A and the B. As far as enrolling in any supplemental coverage, you're going to either go to the insurance company directly, or what I would really advise you do is talk to an agent. Now, I'm myself a licensed agent in Minnesota and happy to help you through the process of getting supplemental coverage and picking the plan that's most appropriate. But if it's not me, I would recommend talk to someone who's got some experience. Most agents out there don't have any kind of consultation charges, so it's free to you, and you can have someone then guide you through the process. And if you've been on Medicare, you're starting to look at Medicare, it can be pretty confusing. So again, having a resource that you can count on, someone reliable and knowledgeable, always a good way to go. You can, though, if you want, just apply, over the phone by calling into the insurance company or going on to most insurance companies' websites will have a portal where you can apply for the plans as well. The annual election period, remember, occurs, well, no, I don't think we covered this. This is between October 15th and December 7th of every year. Now, this is a time of year when everybody that's on Medicare can review their needs and decide if the supplemental, that extra plan that they have above and beyond what Medicare offers, is still going to work for them moving into the next year. If it is, you don't need to do anything. You don't need to apply again. But if you want to change and pick a different supplemental plan, that's your time period to do it. And any plan elected between October 15th and December.
Did we lose him? Did everybody else
I'm
lose him?
just gonna say he froze up.
Okay, well, chances are good that, nope, we had lost you there for a second, Nelson, so
Oh,
we were hoping you'd come back.
oh, good. Oh, sorry, guys. So did I go back to the annual election period? Did we get through that?
That's what you were talking about. You're kind of at the end of that.
Okay. So thank you. And quite simply, that annual election period is the time when you can choose a new plan for the following year. Any new plan you elect during that period starts January 1st of the following year. So again, a time to review your needs, do some shopping, and ensure that you're going to have the best plan moving forward. The open enrollment period, then the last period listed on this slide, this one is only going to apply to people who have elected what's called an advantage plan. Now, an advantage plan, that's a type of plan insurance companies offer that gives that extra coverage above and beyond what Medicare offers. If you take an advantage plan and then during the first 3 months of the year decide, boy, that didn't work how I thought it was, or maybe your needs have changed, you actually get a chance to drop that advantage plan and pick up something else. So it kind of works like a trial period. It's one I find a lot of people aren't aware of, but it can be very important if you get into a plan you thought was going to work one way and it doesn't. Or again, if your needs change, you still get that opportunity to move and choose something better for your needs. All right. Any questions on those time frames, those different periods? Okay, just shout them out. If you guys got questions, just let me know. So let's go now and look at the benefits that the government is offering. So this is going to be your Part A and Part B, original Medicare benefits. What do those look like? And we'll start with Part A. So Part A is primarily set up to cover you when you're in the hospital. But as you can see, it's also going to include coverage for skilled nursing. And skilled nursing would be somewhere you go to recover after you've been in the hospital. And it's also under Part A going to cover home health and hospice. Now, most people on Medicare do not have a monthly premium cost for Part A. All right, you get it at what's called premium free, but that's a little misleading because how that works is as long as you have worked 10 years or had a spouse that's worked at least 10 years in the US, you've already paid enough for this Part A. So think of that FICA tax coming out of your paycheck. Portions of that are going to go to cover this Part A. And if you've worked 10 years, you've already paid enough. You don't pay anything more than what you already have. All right. The inpatient hospital benefit for Medicare is going to be split into 3 different periods. So the first period is going to cover the first 60 days you're in the hospital. And for those first 60 days, you have a deductible this year of $1,484. So you're going to pay the hospital the first $1,400. And after you do, then Medicare is going to come in and they're going to cover 100% of all your eligible costs. Now, if you get into a little more extended stay in the hospital, the next period is going to cover 30 more days. Those would be days 61 through 90. But now for those days, you're going to have a daily copay of $371 every day. So that can start to get obviously more expensive. And the third and final period, which offers 60 more days of coverage, those being days 91 through 150, now that daily copay, it's still there, but it doubles and goes up to $742 every day. Now, these last 60 days, you can see in parentheses, these are referred to as lifetime reserve days. And that means kind of like what it sounds like. If you start getting into those lifetime reserve days and you use them, they're gone. You never get them back. So you really want to think of your inpatient Part A benefit is 90 days of inpatient hospital coverage, and that would be per benefit period. Now, a benefit period is going to start the day you go into the hospital, and that'll end 60 consecutive days after you've been out of the hospital. So if I give you a couple examples, I think it'll help illustrate this. Say you go into the hospital for 2 nights, and then you go home, and let's say 40 days after you're home, you need to go back to the hospital. And it could be completely unrelated to why you were there the first time. Well, in that example, you have not been out of the hospital those 60 consecutive days. So you're actually still in the same benefit period, which means when you go back in for that second time, because you've already had 2 nights under your belt, now you're on day 3. So those days are going to keep accumulating. Now, let's say you go into the hospital 2 nights, only this time, it's not until 61 days that you've been home that you need to go back in. That's going to trigger a whole new benefit period to start. So now you're back to day 1. And you're also going to be back to meeting that $1,400 deductible again. So might have to hit that multiple times in the same year, depending on how often you're in and out of the hospital. But that's the Part A. So you can see, this is one reason why people add supplemental coverage, because there's some gaps here, right? There's some fairly significant out-of-pocket costs you might incur when you're in the hospital. All right, well, let's look at Part B is in Bravo Medicare. This is going to cover everything you do outside the hospital. This is, in fact, where most people on Medicare are going to get most of their care. So we're talking about office visits to go see your doctor, whether it's a primary care physician or a specialist. This could be durable medical equipment like oxygen, canes, walkers, CPAP machines. This could be diagnostic tests like x-rays, MRIs, CT scans, radiology. Might be a trip to the emergency room or urgent care, an ambulance ride. So again, a lot of things fall under this outpatient umbrella. Now, unlike Part A, with Part B is in Bravo Medicare, you will have a monthly cost. Everybody pays something. And you can see it starts at $148.50 a month, but it can go up to just over $504. So you got a pretty big range there of what you might be paying every month to have Medicare. Now, Medicare is going to determine what you pay every month for Part B based on your income. And quite simply, the more you make, the more you're going to pay. Now, on the next slide, I'm going to give you a breakdown and show you a chart with an income range and then what your corresponding Part B premium is going to be. Just keep in mind that Medicare, when I talk about income, they're looking specifically at your modified adjusted gross income from 2 years ago. So for 2021, they're going to be looking at that 2019 modified adjusted gross income, whatever that is, will determine what you pay this year. And every year, though, they're going to readjust that if need be. So if your income changes year to year, so too then will that Part B monthly premium. Now, there is a deductible for your Part B services, relatively low, $203. So you pay the first $203 for any covered Part B outpatient services. Then it turns into an 80-20 plan. That means Medicare pays 80% and you will pay the remaining 20%. Now, if we go to the next slide, I'll indicate here those income levels for paying more than the base rate of $148.50. So in the column to the far left, right over here, if you're filing taxes individually and your income is $88,000 or less, you're at that $148.50. If you file taxes jointly, married couple filing taxes jointly, and your income is less than $176,000, you're also going to be at that $148.50. And you can see these different ranges of income and what that corresponding Part B premium will be. Now, we haven't got into Part D yet. That's going to cover medications, but just know based on this chart that you're also going to have an income-related adjustment for what you pay for a drug plan based on income as well. All right. So let's talk about some things not covered by Medicare. I'd say probably even more important to know what Medicare does cover is what they're not covering. So first of all, I'll come back to that first point in a minute, but we'll drop down to the second bullet point where we talk about inpatient hospital days beyond Medicare's limits. Well, we know now that you get those 90 days of inpatient hospital coverage per benefit period with an additional 60 lifetime reserve days to use if need be. But if you exceed those limits and you just have this original Medicare, there's no coverage there for you. The annual physical. So Medicare gives you 12 months from whenever your Part B is in Bravo, Medicare starts, to go get what's called a Welcome to Medicare exam. And that's a pretty thorough annual physical, but they only give you that one time in your life. So every year after the first year, they're giving you what's called a wellness check or a wellness visit. And that one's pretty limited in scope. It doesn't really give you much more than your height, your weight, and your blood pressure. Now, there are some bigger kind of ticket items that Medicare will cover for preventive services like colonoscopies and mammograms, but that actual office visit to go see your doctor are going to be limited by that wellness check. Some other preventive services Medicare just does not cover would be vision exams, hearing screenings, and most of your dental care. If you travel outside the U.S. and you just have Part A and Part B Medicare, you will likely not have any coverage at all, really set up to cover in the U.S. only. And then we talk about prescription drugs not covered by Part A or Part B. So let's talk about what medications Part A and Part B does cover. So first of all, when you're in the hospital, any medication administered to you, that's covered by Part A. Now, Part B is in Bravo medications. Those are for the most part going to be drugs that are also administered to you, not necessarily in a hospital, might be in a clinic setting, like say a cortisone injection. Or the most common Part B medication would be chemo. All right, those are covered by A and B. But you know, most of us are going to get our medications when the doctor writes the prescription and we go to the pharmacy to get those filled. That is not covered by A or B as in Bravo. To have that kind of coverage, you need to add a Part D drug plan. And Medicare doesn't cover that. Now, Medicare makes the rules on how drug plans need to work, but drug plans are always going to be administered by insurance companies like Blue Cross. All right. Any questions on that original Medicare before we move into some of these different supplement type of plans?
I guess I can easily ask a question because it pertains to me. I was determined to be legally blind and deaf a little over 10 years ago. So I got Part A, they had sent me. And then when I had my stroke about 10 years ago, really, they paid a ton at the Mayo Clinic, you know. And so I have been wondering how to get Part B, which you somewhat helped right here. So, you know, my situation is the same. Wait till about 4 months because I did call Medicare and did a text conference with somebody, and they couldn't help me with anybody. And so my regular insurance is with you guys, in fact, through my wife's work. So I've got Blue Shield right now, but the damn deductible I think is about $10,000. So yeah, it doesn't even matter what the payments are. Yeah, that's why your payments are cheap every month. I only pay about $110 for my coverage, but it really doesn't cover anything.
Yeah.
So I'll quit at that for now, and I'm sure you're going to tell us more what's going on.
Yeah, so no, you know, that's that in that kind of situation, if you come off of the employment plan through your wife, there's a different kind of path you take to get that Part B Medicare added. And basically, it's just an extra form that you fill out. And I'd be happy to email or mail that to you. It's called a request for employment information. It's one-page form. You're going to fill out the top part indicating really just identifying yourself. And then the bottom part, your wife's employer would be filling out. And what they're doing there is testing to the fact that, yeah, we've been offering creditable coverage. And in that sense, then there's no late enrollment penalty for adding the Part B. And then you can drop off of your wife's plan and, you know, have the Part B and then add any kind of extra supplemental coverage. And I think there would be some definite options for you that would be much better than that higher deductible type of plan that you have right now.
Agreed. Okay, thanks.
Absolutely. Thanks for the question. Well, we'll keep moving here and we'll get into the supplemental plans next. And we're not going to get into the specifics of the Blue Cross plans. I intended this really just to be an overview. So I want to start by identifying what are the different kinds of supplement plans that are available. And really, no matter where you live in Minnesota, and no matter what insurance company you're using that's providing these extra supplemental plans, the plan is going to fit into one of four categories listed on this slide. The first are what are called Advantage plans. And I tell you that one of the confusing parts of Medicare is there's a lot of different names for the same thing. So Advantage plans, you'll also hear referred to as Part C Medicare. You'll also commonly hear them referred to as replacement plans. And the reason folks will call an Advantage plan a replacement plan is because when you have one, the insurance company you have that plan through, that Advantage plan, we're basically then replacing Medicare. All right, so all claims and all administration of the plan, that's handled at the insurance company level. Most of your Advantage plans available in Minnesota, they're going to include both medical and a Part B drug plan. So they combine together. A lot of Advantage plans will also include some other extras like dental, vision, and hearing. So people like these Advantage plans because it gives them the convenience of having one card, one bill, kind of a one package solution. So those are kind of and we'll talk in more detail, but just a general overview there of Advantage plans. Next, we have Medigap plans, or these are also called Medicare supplements. These are kind of the exact opposite of the Advantage plan. On a Medigap plan, Medicare is actually your primary insurance. So all administration and all claims start at the Medicare level. Then that claim is going to work its way to the insurance company, and we're going to fill the gaps and cover the things Medicare is not, at least in part. Depends on what Medigap plan you choose as to how much of that gap we're going to be filling at the insurance company. And these plans can also only be medical coverage. All right, so you can't bundle everything together like the Advantage. Now, some people actually like that because it gives them the freedom to choose whatever drug plan they want, or they can go get whatever dental plan they want. Right, so you kind of a la carte with adding that extra coverage. And then we have the third plan type, what are called cost plans. Now, back in 2019, the federal government basically eliminated cost plans in most of Minnesota and really across the country. In fact, right now, there's only 21 counties in the state where cost plans are allowed to exist. If you do live in one of those 21 counties, these can be really good options. They're kind of like a hybrid between the Advantage and the Supplement. So on a cost plan, any services you get in the hospital, Part A, Medicare is actually your primary insurance. But if it's something you do outside the hospital, most things you do outside the hospital, then the insurance company is your primary. You know, and the reality is you don't need to know that. You just need to present your Medicare card and your insurance plan card, and that'll all happen behind the scenes, who's paying what and when. But that's really kind of what defines the cost plans. And again, the federal government eliminated those. So the reality is for most people in Minnesota, these cost plans aren't options, but they are still out there. And then last plan type, drug plans. Now, if you have the Advantage plan, you more than likely have medical and drug together. But if you have a Medigap plan, you're just going to have medical. So you'd need to look at one of these separate independently working drug plans. The cost plans have a bundling option, or you can get a separate drug plan. They give you that flexibility. But those are really kind of the 4 different types of plans that you can enroll in to get more coverage than what Medicare offers. So a little more detail on the Advantage plan. So how this works is it's going to combine your Part A and Part B. And remember, we're replacing Medicare. So we're going to cover everything Medicare does, and the Advantage plans are going to give you more. All right. So it's going to go above and beyond, but everything Medicare covers, you'll definitely still have. There's a few different types of Advantage plans. You can see there's HMOs, PPOs, and then there's Medicare Advantage plans with prescription drug coverage. The HMO and the PPO are really getting towards network. There's not too many HMO plans out there, but they do tend to have a more focused network. Sometimes they're less expensive for that, but the PPO plans are usually going to give you broader access. There are some Advantage plans in the state that just give you medical coverage. I've put a lot of veterans on plans like that who have a drug benefit through the VA. They don't really need a drug plan, so they can just take a medical Advantage plan. But most of them, again, are going to include both the medical and drug coverage. Again, all the benefits Medicare covers will be covered, and then more. You are always, no matter what plan you're on, and on these Advantage plans, even though we're replacing Medicare and basically doing everything Medicare would be doing, you still pay them. So you're still going to pay Medicare, whatever that Part B premium is, and that'll be true, as we'll see, for all the plans. And then there's usually an additional premium to pay monthly to have the Advantage plan, and you would pay that directly to the insurance company. So those are your Advantage plans. Any questions on how those Advantage plans work?
Well, the Advantage is like the one Joe Namath is on TV about all the time, right?
Yeah, the Advantage plans are very competitive in Minnesota. And I mentioned in 2019, the cost plans were eliminated, which affected about 400,000 Minnesotans. It was just a huge impact. And maybe some of you remember that. But another thing that happened in 2019 is Minnesota decided to let for-profit insurance companies come into the state and offer Advantage plans. So, like Aetna's, like United Healthcare's, big national companies. I think ultimately for consumers, this is a good thing because there's more competition, but we started to see a lot more advertisements, and that all comes starting in October through basically the end of the year is when you see a lot of that on TV or you hear that on the radio. And Joe Namath talking about plans, hey, you don't pay anything, right? And you get all this stuff. That's an Advantage plan because you're getting medical, you're getting drug, the dental, the vision, the hearing. A lot of them work that way. And a lot of them are at $0. There's a lot of Advantage plans where you don't pay a premium. But, any plan where you don't pay anything for it, when you start utilizing benefits, you're going to be paying a little bit more out of your own pocket, as opposed to a plan that has maybe a higher monthly premium. Now you're going to have less out-of-pocket exposure. So, and that's one of the big things in choosing a plan is finding that balance, right, between what do I pay every month and what are my out-of-pocket expenses going to look like. So, all right, well, let's go on to the Medigap plans or the Medicare supplements. These are designed, again, to fill the gaps. So remember, your claims are going to go to Medicare first. But as we saw with the benefits Medicare offers, there's a lot of gaps there, right? So then the plan comes to the insurance company and we fill those gaps. And there are plans that pretty much fill those gaps completely. leaving you with very little, if any, out-of-pocket cost. And then there's some supplement plans where you may still have some responsibility. So you've got a broad range of different coverage types within these Medigap plans. You do get the freedom to travel anywhere with these. And in fact, even if you move out of Minnesota permanently, you would take the benefits the Medigap plan offers with you. So these plans are completely portable. Now, most Advantage plans are going to give you some sort of travel benefit. Some of them are a little more regional where you can travel. Some of them are around the whole country, but these Medigap plans really open it up. And indeed, if you do permanently move out of Minnesota, the benefits would go with you. So it's going to cover, depending on the Medigap plan, you get some of the co-pays that Medicare does not cover and some of those co-insurances. You're always going to be paying Medicare, whatever that Part B premium is. And then you're going to have a monthly premium that you would pay to the insurance company to have that Medigap plan. So those are your Medigaps. And just remember, Medicare is your primary insurance with those. The cost plans. So again, kind of a hybrid between the Advantage and the Medigap plan. But again, this is going to provide you more benefits than what original Medicare is covering. And the one big thing that all these plans are going to do is they're going to give you an out-of-pocket max. So they're going to limit what kind of costs, what kind of bills that you'll get medically. And that's probably one of the biggest reasons people add, add these supplemental plans. Again, you're going to pay that Part B premium. You do have the flexibility with a cost plan to bundle a drug plan with it. So you have one card and one bill, a one package solution. Or you can go choose one of those independent standalone drug plans. And on most cost plans, then that allows you to move between the medical benefits the plan offers month to month. So I want you to think of the cost plans, one, pretty restricted on who can get them. You do need to be in one of 21 counties, but if you can get it, they just have a lot more flexibility with how the benefits work and how you can move between the different cost plan options.
So that is available to, I thought you said it wasn't in Minnesota?
It's in Minnesota, but only in 21 counties.
Okay. Are we down here, Blue Earth, Nicollet, any of that?
You're going to have some counties down there. Just looking at the map.
Not Blue Earth County.
It's not, Blue Earth is not one of the counties. If you want a complete list, like Goodhue County would be included. LeSueur County is one of the 21. Rice County, one of those 21. And if you want a complete list, I'm more than happy.
Curious about it. Can you take us back to the screen right before this really quick? I just wanted to shoot a screenshot. Thank you.
Absolutely.
Thank you.
And if you want me to send a copy, I'm more than happy to do that as well.
As a matter of fact, Nelson, if you want to send me a copy, I can send it out to everybody on our list.
All right, got it. Making a note of that.
Thanks, Mike.
Certainly.
Perfect. Okay, well, let's move to the prescription drug plans. And remember, most of your Advantage plans include drug coverage, so you wouldn't need one of these. But if you have the Medigap plan or a cost plan without the drug coverage, then you can look at these. And there's 28 different standalone drug plans available in Minnesota this year. So this is basically, again, going to cover your drug costs when you go to a pharmacy. Now, there's a few key things to keep in mind here. First, every drug plan has a formulary. And a formulary is just a list of the drugs that plan covers. There is no drug plan that covers all medications. So your first consideration in choosing drug coverage is take a look at that formulary. Be sure that all your medications are on it. Now, the other thing to consider is all insurance companies are going to classify the drugs that they cover by tier levels. Most plans have 5. Your first couple tier levels are usually your generic drugs, tiers 1 and 2. Getting into tiers 3 and 4, you're getting into brand name medications, and then tier 5 is usually designated for what are called specialty drugs. And, the higher the tier level gets, typically, the more you're going to be paying for the cost of that medication. So the tier level is going to be important. And then we'll get to, I believe on the next slide here, talk about the coverage gap. So the coverage gap is a Medicare rule that applies to all drug plans in the country. So to get to the coverage gap, how they, and Medicare defines this, they set the dollar amounts and the percentages that I'll talk about here in a second. So once the coverage gap, how this works, once what you have spent on your medication and what the insurance company has subsidized, when those two numbers together reach $4,130, you're in the gap. Now you're going to go to paying a straight 25% for all covered medications. All right. To get out of that gap, once what you and you alone have spent on medications reaches $6,550, you've reached what's called catastrophic coverage. Now you pay $3.60 for covered generics, $8.95 for covered brand name drugs, or 5% of the cost of those meds, whichever is greater. And you pay according to that schedule until the end of the calendar year. So with Part D, there's 4 kind of phases of coverage. The first phase would be meeting your deductible. Now, not all plans are going to have a deductible, and some plans have a deductible, but only for certain tier levels of medications. You can see the max deductible is $445. So it can't go any higher than that. But that's your first consideration. Do I have a deductible? Do I need to meet it? The second consideration with drug coverage then becomes the cost sharing. All right, you're going to pay some, the insurance company is going to pay the rest. And that depends on the tier level the medication's classified under. And different drug plans might have different tier levels for different medications. And then the third consideration would be the coverage gap, if you get there, and then when you get there, right? Because it usually represents paying more money, that 25%, than what you were when you were cost sharing with the insurance company. So it's not a good thing. Most folks get to that coverage gap, and again, the cost of their medications goes up. And then the fourth phase of coverage would be catastrophic, and that's where you've already paid $6,550. Now, last numbers I saw was about 12% of Americans actually get into the donut hole or this coverage gap. So most people avoid it, but if it does affect you, you're going to want to know about it, and it can change which drug plan you pick. Now,
oh, I'm sorry. I was just going to say, who would be apt to fall into that coverage gap donut hole thing?
Well, people on expensive medications, if you're taking, say, insulins, that can be a very expensive medication.
My husband was on an oral chemo, and that took him into that.
Oral chemo. Yep.
Yeah.
And some of those chemo drugs are Part B as in Bravo, but not all of them. A lot of the oral chemo medications are covered by the Part D. And those can be expensive and get you into that coverage gap. Now, I can run, or any agent that's out there, most of them, can run what's called a drug calculator for you. And that's simply where we get the name of your drug, the dosage, and how often you take it. And we put it into a calculator. And it'll tell us on all the different drug plans available to you if your drug's covered. If it is, what tier level it falls under, and then what your corresponding monthly and then annual cost will be for your medications. If you're going to get into the gap, and if you do, will you ever get out and reach that catastrophic phase? And it'll give you the breakdown of what you're going to be paying during those different phases. And, the people I work with, for the most part, the drug plan that I'm going to recommend that they enroll in is the one that costs them the least amount of money for the particular medications that they're taking. So I'm happy to do that for you too.
I just switched my husband here at the beginning of the year, when we were in that open time.
Yes.
He was on Blue Cross Blue Shield, or what do you call it, Blue RX. And it had gone, when he first started on it, it was like 30 something a month. Then it went to like 46, and it was going up to like 65, 68 bucks, something like that this year. We ended up going to Well Care. Everybody,
Okay.
I don't know if it would work for everybody, but it's like $15 a month, and he's only on like 2 medications, a blood pressure and a acid refluxy thing. Obviously much different than someone being on chemo drugs and all that. But yeah, sure. I was glad we made the switch, and so yeah. But thank you.
You want to do that every year. And I work for Blue Cross, and I'll tell you, my parents were on one of those Medicare Blue RX plans that Blue Cross offers, and I switched them off of it because there was a big increase. So that happens. You really got to always reevaluate, and it does help to have that agent, someone
Yeah,
that you can
she's
trust.
the one
that
who
you can
found it for me. She had put her own mother on this other plan and, yeah.
Yep. Yep. And you just need that kind of guide to help you through it. So every year, no matter who you are, no matter what plan you have, you really want to get with somebody to reevaluate your plan and see if there's a better option. And, you're going to save some money and maybe get a plan that works just as well, if not better, for less money. So important to do that every year, do that evaluation. All right. Well, I have to mention here the late enrollment penalty as it applies to Part D, because I do meet with a lot of folks, especially new to Medicare, that will tell me, look, I don't take any medications, or I'm on very inexpensive medications. Why should I have a $15 or any amount that I pay to have a drug plan? And one answer to that is, well, if you don't, and then later down the road, maybe you get some more expensive drugs such that you want to have a drug plan and you enroll in one, there's going to be a penalty. Medicare penalizes you. Now, the penalty is going to be 1% of the national average cost of a prescription drug plan, which is about $50 a month this year. So 1% of $50 is 50 cents. And then Medicare is going to multiply that 50 cents by the number of months you could have had a drug plan, but you didn't. So you can see the longer you go without that drug coverage, the higher the penalty potentially becomes. And whatever it calculates out to be, you're going to pay that every month on top of the cost of whatever drug plan you enroll in. And you'll always have that penalty as long as you have a Part D drug plan. If you never take a Part D drug plan, you'll never have the penalty. But again, it's something to be aware of. I have run into people for 15, 20 years. They haven't had drug coverage. And boy, that penalty at that point becomes pretty significant. And that's kind of a punch to the gut there if you got to pay that every month. So be aware of that. All right, well, probably don't need to tell you folks, medications can be expensive, right? We talked about some oral chemo meds, and that's just the tip of the iceberg. Lots of medications become very expensive, and there is some help out there on Medicare to help cover some of those costs. To find out if you qualify for any of that extra assistance, you can either contact Social Security or Medicare, and on this slide, I just have both of those phone numbers available for you. Any questions about those coverage options, those supplemental plans, or really anything? That kind of brings us basically to the end of the content that I wanted to present. So happy to address any questions you might have.
I'm
Go ahead, Mary, I'm sorry.
okay. I'm curious, those cost ones that are only in the 25 counties or 21 counties in Minnesota. What happens if, like, you got it in LeSueur and then during that year you moved out of LeSueur County? Would you be grandfathered in, or?
No. So if you move out of the county, any of the counties like LeSueur County, where those cost plans exist, you couldn't have the plan anymore. That move would create a special enrollment event where you can now enroll in a plan available in the new county where you reside.
Okay.
And that'll be important too with the Advantage plans. A lot of Advantage plans out there are also regional. For example, Blue Cross has 3 regions. We have 9 counties surrounding the metro region, the western part of the state, and where, if a lot of you folks are down in the Mankato area, we have our southern region, and the plans are a little bit different region to region. And if you move from one region to another, you're going to have to switch to that region plan. So that's an important factor in a lot of the plans, is that county where you reside.
So you actually would, like, Blue Cross Blue Shield would not change you if you changed from one county to the other. You have to initiate the change?
You have to initiate. If we found out you moved, we'd say, well, you're not eligible for the plan. It's going to term, but let's talk about options on what kind of plan you can move into in that new county. And again, that's where, having that agent or that person you can talk to will help you through that process.
Okay.
Good question, though, that those counties do become very important. Anything else, guys? Any other questions? I know it's a lot of information.
Yep, I just have one that I would like you to address for everybody. I understand there's something with between the Advantage plan and the Medigap and whatever, or even the costing, that if you opt for, what is it? If you opt for Advantage, you can't go the other way. But if you
Yeah.
go Medigap or the cost, you can always go to the Advantage. Have I got that right in my head or not?
Yeah, so it's with the Medigap plans. There's a 6-month period that starts when your Part B is in Bravo Medicare starts. If you enroll in a Medigap plan during those first 6 months, you have what's called a guarantee issue. That means you fill out the application and you're in. But in most cases, if you apply for one of those Medigap type plans, after that 6-month period, there will be health questions that go along with the application, which means our underwriters are going to get involved. They're going to look at any pre-existing conditions, and they do have the right to deny you coverage.
Okay.
Now, there's a few ins and outs of that, but that's the general rule. Moving from one advantage plan to another, no problem. There's never any kind of questions that'll be addressed. But if you start with an advantage plan and you're on it a couple years and then you want to move to the Medigap type, now there's health questions and no guarantee you'll be accepted. So, generally speaking, when you're new, especially to Medicare, if the Medigap type plans look like they're going to suit your needs, not just, for short term, but for long term, really the best time to apply is when you're first eligible.
Okay. Thank you.
Absolutely. Any other
Well,
questions?
the biggest thing I got from you, I have talked to local agents. I mean, you have told me more than I have heard. So it seems to me the ticket is find a good agent,
Yes.
and they will take care. Just like you said with the medicines. Yes, I take insulin, 2 kinds of insulin. So when I first became diabetic, it was $3 a vial. Now it's over $330 a vial.
Yeah.
So, okay. And so you're going to give your information to Mike.
Yep.
And all of our emails so you can send it to us then.
Yes. And absolutely. And I'll send that, Mike, to you here before the end of the afternoon. And you can send that out to everybody or however you want to handle that. I've had my contact information up. I'll leave it up on this last slide. And if anybody, if you jot that down, by all means, feel free to reach out to me anytime. I do operate as an agent, licensed agent in Minnesota, and I can help you choose your plans. I can help address any other questions that you have. Or if there's more material that you'd like me to get to you, I'm happy to do that. Guys, use me as a resource. No charges for any consultations or any kind of information I get to you.
Wonderful. Well, thank you.
Nice.
Yeah,
Thank
actually,
you.
what I will do, Nelson, I'll wait until we get our the video from this presentation posted, and then
Okay.
I'll send an email with that link and
Perfect.
with the link with your information.
Great. Well, Mike, thank you so much for giving me the opportunity to be here, and everybody, thank you for listening in. And like I say, if there's any other questions, guys, by all means, feel free to reach out anytime.
All right. Well, thank you very much.
Thank you.
Yeah, thanks, Mike, for putting this together. Well, this has been very informative.
Well, and I will tell you, Nelson contacted us, so he's not only an agent, but he's an advocate. So,
Absolutely.
Good deal.
and we like to offer this. I mentioned to him, we usually offer something near the enrollment period toward the end of the year through the Minnesota Valley Agency on Aging. So look for that too, somewhere around October or November. Because we were talking, Nelson and I, and pretty much said, a lot of it depends on how the information is presented. So we like to offer it in various forms because sometimes something works for one person that doesn't work for somebody else. So we like to offer it often. It's an important bit of information to get out there.
Absolutely.
Exactly. Wonderful.
All right.
Thanks, everybody.
Thank you.
Thank you.
Thank
Have a great
you.
weekend.
Thanks, guys. Have a good weekend. Thanks, Mike.
Okay. Thanks.